what are some of the typical treatments for mental illness? Now, I've heard of people that are actually, smoking
Yeah.
uh, marijuana, medical marijuana.
Mhm.
Is that something that you find has been helpful, along with some of the other drugs, like I think it's Zoloft or, some of the other drugs that you're using to help with mental illness? But I'm really curious about the marijuana piece because I have some people
We
that are
all
in
are.
my uh,
We all are.
no, I'm because I know that a lot of people feel uncomfortable taking some of the prescribed drugs.
Hmm.
Absolutely.
And as an alternative, I'm thinking, have you seen more progress or more people who have been able to get help via marijuana as opposed to prescription drugs?
Well, me personally, I prefer for someone to smoke than
Hmm.
to take the prescription because the prescription drugs actually make you look and feel like a zombie, like you're just staring, right? You're
Mm.
not communicating, you're just going deeper and deeper into depression. That's how I feel. Now, the marijuana, the medical marijuana, it's not legal here yet. So we don't,
Mhm.
we can't see if it works, right?
Yes.
But I have heard that a lot of people are doing that versus the actual prescriptions. And I have to agree. I mean, I think we would see way less mental illness if
Hmm.
the whole world could get medical marijuana, like, and it makes you comfortable, it eases your mind. um and I feel like you would see more of a progress with that versus the medication alone.
And I come from a state, Rhode Island, where it is legal, you know, and the line is around the corner,
Yeah.
in terms of the medical and also the recreational as well.
Right.
But you see a lot of people getting prescriptions, and so I just kind of threw that out there. But in addition to the marijuana, what are some of the other typical treatments for mental illness? What are the more traditional type of treatments that
Pretty
people
much.
can take part in?
Pretty much just therapy and
Meds.
medication, and that's about all that. And of course, if you're really to the point to where you need to be committed, the state, you would belong to the state, but the state would commit you, right?
Hmm.
um which is the worst thing that could possibly happen. But other than that, there's no other treatment for that because we have depended on medication so long for several different illnesses. That's the first thing they do. They don't try to talk to you. They say, here, go get this prescription filled and you'll feel better. That's how I look at it. And that's what therapists do. Here's your some medicine. Go take this. Make sure you stay. And I don't like stuff like that because you're turning them into someone that they're not. A lot of it, you either sleep all day or you're just sitting there looking. Um, you can't function like a normal person. So
But that's in
And,
specific sicknesses, right? And illnesses.
that's
That's not
when
like, like a bipolar
it
person.
is.
They can function daily, can they, on the meds? Or
It depends on what they're on
mm.
because a lot of bipolar, schizophrenic, PTSD, depression, they take the same medication.
mm,
So,
So bipolar is basically the highs and the lows.
right.
People have extreme highs and extreme lows.
Hmm. Yep.
Um, and can that be regulated or
It,
diminished
it
uh, as a result of medication? And you find that it's helpful?
bipolar is forever. Once
Mm.
you're diagnosed with bipolar, let me make this clear. Once you're diagnosed with anything from a doctor, it
Hmm.
is on your record for the rest of your life, the
Mm.
medical record. So let's just say I go to the doctor and they say, "Oh, Miss Hall, you're bipolar." from that day forward, anybody that looks at my record, they're gonna see that I'm bipolar. I don't care if I'm handling it good, I'm doing good with it, I'm taking my medication. I'm known as being bipolar, just like a kid in school with ADHD. When they diagnose these kids with ADHD, they will be marked from the time they're diagnosed to the time they graduate. They're going to be labeled as a bad kid because they have ADHD.
And that's what we have to stop. We have to keep this going, this awareness going, because those conditions aren't any different from somebody having diabetes,
Right.
or high blood pressure,
Right.
or it's a condition that we're dealing with.
But you cannot get rid. You can control bipolar,
Mhm.
but you cannot. That is something that will stay with you forever. Now, depression, very curable. Bipolar, schizophrenic, you cannot get rid of it. It's
Mm.
always going to be there because your brains, you have multiple personalities in your brain.
Mhm.
So one minute I can be cool with you, the next minute I don't like you, and that's how bipolar works.
Mm. So isn't bipolar a form of depression now? Or is it?
It comes from depression.
Okay. Okay.